Welcome. If you're joining me for this explainer today, well, you're likely searching for answers. Answers for that agonizing leg pain that just absolutely will not let up. You know the kind. As a traditional bone setter, I've seen countless folks walk through my clinic doors, literally defeated by this relentless discomfort. But listen, today we're going to expose the true anatomy of your pain.
Let's evaluate your specific symptoms right off the bat. Ask yourself this. Does your leg feel significantly worse when you sit down for a long stretch? Or is it worse when you bend forward to, say, tie your shoes? Actually, just keep your answer in the back of your mind. We're turning our time together right now from just passive listening into an active diagnostic consultation. So, what you're experiencing is the notorious sciatica. It's this precise, searing line of pain traveling from your lower back, or maybe your buttock, shooting right down the back of your thigh and calf. It feels exactly like an electric shock, doesn't it? Look, it's terrifying, I get it. A lot of people panic, genuinely fearing permanent paralysis. But let's take a collective breath here. The sciatic nerve is simply the thickest, longest nerve in the human body. So when it acts up, oh yeah, the pain is immense, but it rarely means you're facing permanent damage.
I want you to consider the sheer, incredible journey of this nerve. It originates way up in your lower back, travels deep right through your buttock, and extends literally all the way down to your toes. Because it covers such a massive distance, there are two primary bottlenecks along the route. Think of them as anatomical traffic jams, where painful compressions are just far more likely to occur.
Now, if we want to resolve your issue permanently, we absolutely must identify the true mastermind pulling the strings on your pain. Sciatica is usually caused by one of two distinct culprits. It's either an upstream compression right at the spine, so a lumbar issue, or it's what I call a midstream ambush, happening deep within the gluteal muscles. We call that a piriformis issue. And trust me, they present very differently.
All right, culprit number one, lumbar disc herniation. This is your classic upstream compression. When you put your body through prolonged sitting, heavy lifting, or even just regular age-related wear and tear, the discs between your lumbar vertebrae, those little shock absorbers, can actually bulge. And that gel-like core, it presses directly, mercilessly against the root of the sciatic nerve.
So how do you spot this upstream culprit in the wild? Well, with a lumbar herniation, back pain and leg pain almost always show up together. That shooting pain down your leg, it's going to intensify instantly the second you bend forward, or honestly, even when you do something simple like cough or sneeze. So remember that question I asked earlier. If you answered bending forward, well, this is highly likely your mastermind. Moving on to culprit number two, piriformis syndrome, the midstream ambush. Right after leaving the spine, your sciatic nerve sneaks beneath this small fan-shaped muscle in your buttock called the piriformis. Now, modern habits, think crossing your legs constantly or sitting on hard chairs for hours, they overwork this poor muscle. It gets inflamed, tightening up, and eventually acting just like a pair of pliers, squeezing the absolute life out of the nerve trapped right underneath it. And here is the absolutely crucial difference. Many patients dealing with piriformis syndrome experience absolutely zero lower back pain. Seriously, the back is completely innocent. Instead, the agony is this deep, severe ache planted right in the center of the buttock, and it gets so much worse during prolonged sitting or walking. If you answered sitting down to our very first question, the piriformis is definitely the one ambushing your nerve.
Treating the leg when the problem is in the back. As a bone setter, I really must deliver a grave warning about this. We see far too many failed cases from treating the leg when the problem is actually up in the back, or vice versa. Blindly applying spinal traction for a spasming piriformis muscle, that's just going to leave your leg numb. On the flip side, aggressively pummeling your glutes with a massage gun when you actually have a lumbar compression, that literally skyrockets the nerve inflammation. Bottom line, incorrect diagnosis equals a whole lot more pain.
So until we can get you a perfectly accurate diagnosis, you need to protect those sensitive nerves immediately. Step 1, stop crossing your legs right now. It places immense, unnecessary pressure on the nerve. Step 2, choose the right chair. You want to avoid those excessively soft sofas or rock-hard stools. And please, stand up every 45 minutes. Step 3, avoid aggressive self-massage. Using brute force on painful knots is a surefire way to exacerbate the entire condition. This right here is where precise clinical expertise becomes completely non-negotiable. At Wong Bone Setting, exceptional treatment always begins with an incredibly accurate diagnosis, and it succeeds through refined, traditional hands-on therapy.
Through specialist orthopedic nerve testing, we dictate your exact treatment path. Now that might be gentle skeletal alignment to decompress those lumbar discs, or it might be deep myofascial release to safely, carefully liberate a trapped piriformis nerve.
Do not let this line of pain restrict your freedom for another day. Your body absolutely can heal, provided it gets the precise therapy it actually requires. So as we wrap up this explainer, I'm going to leave you with one final thought. Which culprit is holding you back? Is it the upstream lumbar compression or the midstream piriformis ambush? It's time to seek a professional, scientific evaluation and let us help you regain that confident, pain-free stride.